Kristin, I'm so happy to have you with us. Kristin is a longtime Sun Valley friend and friend who is a real leader in the food system arena. She is one of the partners in the Rockefeller Foundation's Food System Vision Prize, SecondMuse, where organization has been partnered with Open IDEO and the Rockefeller Foundation to run that prize. And we're really excited to hear next week who the finalists are going to be. As you know, we have a stake in the game. In addition, Kristin's love affair with the food system, I should share, started when she was a teen as a farmer with the Peconic Land Trust. Really exciting that you started that early. She moved to the jungles of Belize to support the development of organic farms, and later as a volunteer on a biodynamic farm in New Zealand. So incredible background in this space. Now she's with SecondMuse, an innovation company that works with visionary corporations, cities, governments, others. Her full bio is on the website, but I just think the breadth and the systems work that you do, Kristin, is really important as you connect the dots, bring together the right partners, exactly what we're working to do today. So with that, I will turn it over to Kristin to host Dr. Mark Hyman, who we're so pleased to have with us.
Thank you, Amy, and hello, Sun Valley Forum participants. I'm so happy to be with you all today, and as Amy said, my name is Kristin Coates, and I am joining you all today from the San Juan Mountains in Telluride, Colorado. So I'm honored to be introducing today's keynote speaker, Dr. Mark Hyman, but before I share his impressive credentials, I wanted to share a personal anecdote. I met Dr. Hyman in January this year in Big Sur, California, at a weekend gathering focused on healthy longevity. And you guys may recall, back in January, we were still hanging out together and sharing meals and not doing social distancing, really getting to connect with people more deeply than through a video call. And it was during that weekend that I got to know the person, not just the 13-time New York Times bestselling author and leading functional medical doctor. And let me just tell you all, Dr. Hyman is the real deal. He is so committed wholeheartedly to the health of people, every single person, and the planet. And we are so lucky to be privy to his wisdom and experience. So now to his impressive credentials. As I mentioned, Dr. Mark Hyman is a 13-time New York Times bestselling author. He is an internationally recognized leader in functional medicine. He is the founder and director of the UltraWellness Center, the head of strategy and innovation of the Cleveland Clinic Center for Functional Medicine. And he is the host of one of the leading health podcasts, The Doctor's Pharmacy, which is FARMACY, with over 30 million downloads. So, Dr. Mark Hyman, I'll pass it over to you. We're really excited to hear what you have to share today.
Well, thanks for having me. I'm really excited. I wish I was in Sun Valley, but here we are, where we are in place. And I'm really excited to be able to share with you some perspective on what's really happening in our food system and how that connects to everything that matters and everything we love, and why now even it's more important than ever to consider how we need to think differently about food and our food system and everything it connects to. And the theme today is really about regeneration. And so I'm going to share my slides right now and see if we can get those up. And about how do we regenerate health for both humanity and the planet. And I began to think about this as a doctor because I realized I couldn't cure diabetes in my office, that no matter what I did, that people were in a system that was driving chronic disease that wasn't solvable by medications or surgery, or even by telling them to do better because of our overall food system and how that was driving so much of the issues. And I think I wrote a book called Food Fix, which is how to save our health, our economy, our communities, and our planet one bite at a time, that really focuses on the interconnections between many global crises that we don't see connected to food, including obviously health, our economic crises, challenges in our communities, health disparities, academic achievement issues, environmental issues, and all these really are connected back to food. There was a recent paper produced by Tufts that was published a few weeks ago, really laying out the ways in which our food system connects to so many different issues. Obviously, chronic disease is a massive issue where we see 6 out of 10 Americans suffering from one or more chronic diseases. We see 45% of us almost obese, 75% overweight. and many, many children. And we also see 1 in 9 households in this country, or 37 million Americans, food insecure, including 11 million children. And it's getting worse with COVID. We're seeing incredible health disparities. We see this more exhibited particularly during COVID season, which I'll get into a little bit more. But this has been going on for a long time with minorities, the poor, and disenfranchised really suffering disproportionate health disparities, and also the economic and opportunistic disparities that we see as part of the structural problems in our society that in part are related to food and the way in which food affects people's cognitive function, academic development, behavior, and so forth. And of course, there's tremendous public confusion about nutrition that needs to be addressed in conflicts. Healthcare costs are skyrocketing. $1 in $5 in our economy almost is for healthcare. Government budgets are strained by this. We've seen a 6-fold increase in the percent of the budget that is directed toward healthcare since 1970. It's almost a third of our federal budget. If Medicare were a company, it would be the largest single company in the world with an operating budget of $1.2 or $3 million. Our competitiveness is challenged. We see healthcare expenditures for U.S. businesses that have increased 15-fold since 1970. Warren Buffett calls healthcare the tapeworm of business, and that leads to stagnating wages and impairing our global competitiveness. It also threatens national security. We see young people between the ages of 17 and 24, 71% of them don't qualify for the military because they're unfit to fight, and mostly due to obesity. And I'll get a little bit more into that in a moment. And also sustainability and climate change and environmental health is directly related to our food system. It's probably the biggest contributor to environmental degradation and climate change. So the question is, how do we address these global crises? How do we, and there's more obviously, but how do we address these? And I think the real goal here is, how do we think like a regenetarian? How do we regenerate human health? How do we regenerate the environment? How do we regenerate communities and all the things that really matter to us? So I think what's frightening to me today is that only 12% of Americans are metabolically healthy. That means 88% of us are not. And particularly in the age of COVID, it's particularly a risk factor, which I'll describe in a minute. But the reason we're metabolically unhealthy is mostly because our diet is ultra-processed food that is driving these metabolic processes of prediabetes, diabetes, hypertension, heart disease, cancer, even dementia. And what's frightening in the time of COVID is that if you have any of these issues, that it is really driving the deaths and severe illnesses. So we would be fine with COVID if we didn't have a population that was so sick. And it may be part of the reason why America is so unduly burdened, because 94 to 97% of the COVID deaths are in those with obesity or chronic disease by being over fat. And that leads to a suppressed immune system, increased inflammation, more deaths if you're overweight from viral flu pneumonia, prolonged viral shedding, and even vaccines won't work in people who are chronically ill or over fat because of a decreased immune response. And these foods, these ultra-processed foods, which are the products of our food industry, are driving massive amounts of deaths globally. 11 million people die every year. That's almost like a Holocaust every year of people dying from preventable deaths due to the ultra-processed food we're eating and the lack of protective foods that are food as medicine. And I think that's one of the challenges we're seeing today, is that this food is spreading across the globe and is accelerating these problems. And I would say it's an underestimate. There's about probably 75% of the deaths are from chronic disease, and most of those are in some way or another driven by our poor diet. And I've seen, the power of food to transform people's lives. And I think, most people don't think of food as a very powerful intervention. Once you get really sick, you need medication, you need surgery. And the problem is the obesity issues are leading to diabetes, heart disease, cancer, dementia, and so forth. And I'll just tell you a quick story of a patient, Janice, who was 66 when she came to see me, and she had really bad diabetes, was on insulin for over 10 years, type 2 diabetes. She was a body mass index of 43, normal was less than 25. She was basically about 250 and change and 5'2". And she had heart failure. She had kidney failure. She had liver starting to fail. She had high blood pressure. She had stents put in. And she'd been on medications, many medications. They were extremely expensive. And within 3 days of changing her diet, using food as medicine, she got off insulin. Within 3 months, she reversed every one of her problems, including the heart failure and kidney failure. And she was on her way to a kidney transplant, a heart transplant. She was off all her diabetes medication. Her blood sugar was normal. Her blood pressure was normal. And her weight dropped 40-something pounds. And after a year, she lost 116 pounds without a gastric bypass. And she grew up eating processed food and never understood that food is not just like medicine. It actually is medicine. It's like code that upregulates or downregulates your biological software with every single bite. So when you eat, you are literally controlling your gene expression, your hormones, your gut microbiome, your immune system, your brain chemistry. Literally everything that your body does is regulated in some way or another by food, and it is very powerful intervention. There is no drug on the planet that could do for Janice what this did, and she saved about $20,000 in copays. So the question is, what should you eat? Well, I've written a lot of books about that. Food, what the heck should I eat? My cookbook, Food, what the heck should I cook? And essentially, it's eating real food. It's eating unprocessed whole foods. And it doesn't really matter that much in that category what you do. And there's all the diet wars out there that I think are unfortunate. But what we really need to be focused on is the commonalities, whether you're paleo or vegan. It doesn't matter. The commonalities far outweigh the differences. The commonalities are that we should be eating whole, unprocessed food. It's unadulterated. It's as close to its natural state as possible. And we'll talk about why that's important. So the scary thing is we're in this terrible situation, as I sort of outlined, but we actually have enormous leverage. And I think that's really exciting is that there are examples of transformation happening. The Rockefeller Foundation's effort is one of them. There are many, many efforts out there to change the food system from a grassroots level, on policy levels, through big companies that are stepping in, through regenerative ag that's happening. So I see within the sort of unfortunate story right around the food system that there is a real opportunity for transformation. It's already happening from the grassroots. And we can do something about this. We can connect the dots and we can tell the story in a way that's coherent, that makes sense, that it sort of creates a common solution to all these problems. These are not all separate problems. Healthcare and the economy and health disparities and academic achievement challenges, national security, the environment, climate. These are not all separate siloed issues. They're all connected. And using real solutions with a coalition of citizens, entrepreneurs, businesses, farmers, philanthropists, policymakers, we can work together to actually make this happen. And it won't be easy, but it's absolutely necessary. And we have to do this. It's bankrupting our economy. That's estimated over the next 35 years. We're going to cost our society, both in direct and indirect healthcare costs, $95 trillion. That's more than the entire global GDP every year. So this is not a trivial thing. And I think that according to the experts in healthcare, the economics, Medicare trust fund is going to run out in 5 years. And we're going to see increasingly the burden of healthcare on our government. And the question I had for myself is I saw Janice and I saw these patients. The question is, why do we have the food we have? If she's sick from eating the food that we have, why do we have that food? And 60% of our calories in America is ultra-processed food. And for every 10% of your diet that is ultra-processed food, your risk of death goes up by 14%. And what is ultra-processed food? It's made from those commodities that we support through our agricultural system, corn, wheat, and soy that are turned into white flour, fructose corn syrup, and refined soybean oils and other processed ingredients that are used in processed food. And by far, the largest lobby group, the largest amount of money spent in Congress and in the government is from agribusiness and food systems. By far, it's probably, twice what any other group is spending, and that is really driving our policies. Just for example, in 2015, there were literally hundreds of food companies that spent $192 million in 1 year on one bill to defeat the GMO labeling law. Now, when you think about that amount of money, it's staggering. In the Farm Bill, they spent $500 million to deal with what they wanted in the Farm Bill. And the food industry, what is the food industry? Well, it's essentially the biggest industry on the planet. It's a food monopoly that's $15 trillion globally in annual revenue. It includes big food companies, fertilizer companies, big ag and seed and chemical companies that are all driving a food system that is crippling humanity and crippling the planet. And these companies really are not necessarily colluding together, but there certainly is a lot of collective efforts to keep the status quo. And it's driving our dietary guidelines, which are unfortunately usurped by the government. Current administration has prohibited any research or any look at the role of ultra-processed foods in health, which is staggering considering it's the biggest driver of disease. But they completely eliminated any ability to look at that research. They eliminated research looking at low carbohydrate diets, which is low starch diets, because most of our diet is starch. They eliminated diets looking at any research looking at dietary saturated fat. So there's a whole series of prohibited subjects and restrictions on the guidelines committee. And it's also highly influenced by lobbyists. 13 of the 20 members of the committee are former or current food industry connected. Either they're getting donations or grants or fees or speaking fees and so forth. And that leads to our food programs being really problematic, whether it's SNAP or WIC. SNAP is food stamps, school lunches, which really don't have nutrition quality as the framework for what they're offering. WIC and school lunch are a little bit better, but there are no nutrition guidelines in SNAP. So you can serve anything, whether it's soda or Cheetos, and they're a fine food to buy. And despite the fact that this is needed to address food insecurity, it's really not addressing health. Food labels are another issue. We have very confusing food labels in this country. It should be like in Europe, they have green, red, and yellow. Green, eat; yellow, eat with caution; red, this might kill you. And I think we really have prohibited the use of proper food labeling and package labeling. Food marketing is completely unrestricted in this country because of First Amendment rights. But unfortunately, nobody's protecting our children. And a friend of mine said, if a foreign nation was doing to our children what we're doing, or we see 40% of kids overweight, we'd go to war to protect our children, but we don't. Things like taxation and other changes in food policies that might really help and have been proven don't really get passed through. Our EPA policies allow all kinds of agrochemicals that are in our agricultural system that have been proven to be harmful, that are banned in many other countries. And our overall agricultural policies don't support a regenerative system, but support an extractive, destructive system that puts farmers in the middle and unfortunately doesn't allow them to create a sustainable living while producing food that's bad for us, that destroys the soil and that destroys the environment. I think so. In terms of the subsidies, if you look at just our My Plate recommendations, which is half of your plate should be fruits and vegetables, and half should be grains, and half should be protein. Half should be fruits and vegetables, a quarter protein, a quarter grains, and then a little bit of a dairy on the side. Well, if you look at the subsidies, if based on what we pay for, corn and other grains would be 61% of our plate. Refined oils would be 20% of our plate. Cotton, we have a giant cotton napkin because cotton is about 13%. Tobacco is about 2%. Fruits and vegetables, we're supposed to eat 50% of our diet as fruits and vegetables. And the amount of fruits and vegetables, we subsidize 0.45%, less than 0.5% of agricultural supports go for fruits and vegetables, and that's mostly for apples. So essentially, even if we follow the guidelines for what the government recommends, and everybody did it, we wouldn't actually have the food to do it. We have about 2% of our agricultural lands used for growing fruits and vegetables, and 7% for producing food for livestock. There's also other issues related to the food we're serving. It's creating enormous impact on our collective cognitive function, and our collective mood and our collective behavior. There's a massive achievement gap in kids who are sick from obesity or depression, which are the two biggest issues driving problems in kids today. And these health issues in these kids leads to poor academic performance. And the CDC put out an incredible report, outlining the role of poor nutrition and poor behavior and poor performance and less ability to focus. There's a massive achievement gap. ADD also very much impacted by this. And we look at school lunches, it could be tater tots, chicken nuggets, cookies, one piece of fruit, thing of milk, which is mandatory because of political lobbying. There's no clear science that shows that milk is helpful. In fact, it may be harmful. And a recent paper in the New England Journal outlined how milk and health are certainly not related. And this is by two Harvard professors who have really reviewed the literature. And I encourage you to look at it if you're having any doubt about the problems with dairy and health. And then ketchup is a vegetable. So that's the vegetable on here. And then an orange, which the kid probably won't eat if he's got the cookies. And there are incredible hopeful things that are happening. And this is sort of what I want to get into now is, so we have these problems. Let's talk about how we deal with these health issues. And then I want to talk a little bit about regenerative ag. So there are school programs all over that are popping up, whether it's Conscious Kitchens in California, whether it's My Way Cafe in Boston, that are bringing in real food to schools. In My Way Cafe, a friend of mine helped pay for it. She's a philanthropist, very, very moderate amount of money. I think it was $65,000, worked with the local schools and was able to build kitchens in these schools, teach the kitchen workers how to cook, hire top chefs to make delicious recipes that the kids would eat and that actually were highly nourishing and that they wouldn't throw out. They did it within the school nutrition guidelines and the school budget for nutrition at school lunches, which is very low. And they also found that these kids had better academic performance, better behavior, better attendance. I went to a school in Cleveland that was so sad. I mean, it was a major high school, mostly African-American, Hispanic, and there was only deep fryer and microwave in the kitchen. I toured a kitchen, massive obesity. There was 40% absenteeism rate, 40%, and only 1% of the high school students graduated eligible to go to college. So when you think about that, how much, and there was one girl walking down with a double fist of 32-ounce slushie and a 32-ounce soda in the other hand. And I think, we just have to really make our schools safe again. And there are many, many examples of ways that this is being done by all kinds of programs around the country. Prison food's another interesting thing. We see prisoners in prisons who are fed whole, healthy foods, reduce violent crime by 56%. And if you add a multivitamin, it reduces it by 80%. Same thing with kids in juvenile detention centers, 91% reduction in violent behavior, restraints, suicides, 100% reduction in suicides, simply by giving these kids whole, healthy foods. They did brain EEGs and they mapped out the abnormal function of their brain that was corrected by whole foods and the right vitamins, which they were deficient in. And then, of course, we have the whole community impact and the structural issues that drive disease and disparities. And we see this no more strongly today than in the face of COVID and the minorities and African Americans and Hispanics. And these communities are targeted by the food industry. They are targeted by undue advertising, targeted them, food in their community that doesn't exist other places, SNAP advertising on the day the SNAP foods come out to promote them to eat more soda. I mean, it's a very coordinated, deliberate, strategic effort targeting the poor minorities. The Rudd Report from Yale Center for Food Policy and Obesity, documents this in great detail. And of course, the health disparities are just an example of not just the food issues, but also structural issues around opportunities, jobs, housing, education. And I think these structural issues have to be dealt with, but they're often challenging to deal with if you have a population that is growing up impaired cognitively, that's growing up sick and disabled because they're eating the food they're eating. And in COVID, we see, for example, in Louisiana, there were 32% of the community was African American and accounted for 70% of the deaths. Same thing in Chicago and same thing in many, many other states. And the reason is complex, but it also includes this underlying disparity in health that is driven through our food system. African Americans are twice likely to get diabetes. They're 4 times likely to get renal failure and need dialysis. They're 3.5 times more likely to need amputations than whites. And of course, the military is another huge factor. I think we see, unfortunately, like I said, 70% of military recruits are unfit to fight. The group called Mission Readiness, which is 700 retired generals and admirals, declared childhood obesity to be a major national security threat. The Department of Defense and the VA are spending billions on diet-related illnesses. I met with a woman who was the chief aide to the second in command at the Defense Department, and she said, on the combat bases, there's just fast food everywhere, and it leads to the combat troops being unprepared to literally go to battle. So it's not even just getting people in, but once they're in, they're very unhealthy. And it led to the fact that in Afghanistan and Iraq, there were more evacuations, about 70+% more evacuations for obesity-related complications than there were for war injuries. Just take that in for a minute. More soldiers were evacuated from Afghanistan and Iraq because of obesity-related issues than for war injuries. So we have a problem, but there is a solution, and I think this is really why I wrote my book, Food Fix. And it's really to begin to think about how do we address this collectively in a strategic way and bring together all the stakeholders to really work on these issues collectively. And the beautiful thing is that, there are some elegant, simple solutions that really focus on the notion of regeneration. And how do we regenerate our health? How do we regenerate our economy? How do we regenerate communities? How do we regenerate the environment? How do we regenerate the climate? And this is really possible. We have the science. We don't need any more science. I mean, yes, we would always love more science, but we know enough now to help fix the problem. And we're trying to build a campaign called the Food Fix Campaign, which is a prescription for fixing America's food-related issues, particularly the chronic disease epidemic. And the food policy things that need to be done, could be debated, but there are some really clear consensus on what kinds of things can make a big difference. And in this Tufts report that came out last week, I think there was a recommendation for a new office of the National Director of Food and Nutrition, as well as a new National Institute of Nutrition, which we don't have in this country. We spend one very fraction of our budget on nutrition. I think the nutrition research that the government pays for is probably $1 billion, and the food industry spends 12 times that, $12 billion. So we have to really, if I were, given the magic wand and I was president or could make some sweeping executive order or legislation, it would be really simple. It would be put the quality of food as the central metric that you measure every single program for in the government policy. This relates to health or disease or food, whether it's agriculture, whether it's healthcare, whether it's school lunches, whether it's our dietary guidelines. The central guiding principle should be quality of food. And I'll explain why in a minute, but food really has the power to resuscitate us and to regenerate us at all levels, both the earth and humanity. And the Center for Medicaid Services, for example, could provide healthy food prescriptions, which would cover a portion of eligible food that's healthy food. There would be over 5 years, there'd be $100 billion in savings, 120,000 less cases of diabetes, 3.2 million less cases of heart disease, and it's more effective and cost effective than current treatments. There was a pharmacy called the Fresh Food Pharmacy as part of Geisinger's efforts to improve the health of their community in Pennsylvania, and they found that there was an enormous benefit to providing whole, real, fresh food to the food insecure, poorly controlled diabetics who were costing $248,000 per patient. These were underserved, food insecure, poorly controlled diabetics. They gave them $2,400 of food for the year. They provided food also for their family, and they ended up having support through coaching and group models and education. And what they found was a savings of $192,000 per patient. That's an 80% cost reduction. Now, considering diabetes is the most expensive thing on our budget, it's the most expensive disease. It's driving most of the healthcare costs. It's 1 in 3 Medicare dollars. It seems like this could be a very simple solution, yet we do not pay for food as medicine. And creating food pharmacies and reimbursement for this could be powerful. We can have many, many ways to integrate this notion of food as medicine into nutrition, healthcare, creating more equity, win-win cost savings. We can create these healthy food prescriptions, medically tailored meals for chronically ill patients that have been proven to save lots of money, improve outcomes. We could actually make doctors have to learn about nutrition by putting it into medical education, licensing exams, and we could also provide it into the health record. So it's a mandatory part of the medical record. So I think this is really important. And governments can also have a huge impact using things like the Good Food Purchasing Program, which allows government institutions and others to follow some certain principles, purchasing food for institutions, whether it's schools prisons or government offices, which is an enormous amount of money, the Defense Department, the VA, and so forth. And the principles are local as possible, humane treatment of animals, healthy, creating sustainability and restoring the environment, and creating a fair working conditions for the farmers and the food workers. So I think these are really simple things that have been scalable and are being used. There are also other things that need to be done, and I think this is a challenge given the First Amendment, but I don't really believe that the First Amendment prevents us from protecting our children. And what we're seeing today in America is that in 2014, there were $17 billion spent by the food industry directly targeting children. Most kids, by the age of 2 can name brand name products because they've seen the advertisements. Facebook had 500 million ads on Facebook targeting junk food for kids. And the stealth marketing is probably now worse than the actual marketing on television, although they still see thousands and thousands of commercials. And this leads to significant changes in behavior. And the worst food gets the most marketing and the most dollars. Now, unfortunately, these food companies are not just targeting America. They're targeting global communities. And there's a great series, if you want to read about this, in the New York Times, called Planet Fat, where they outline the impact on the role of the food industry in driving disease and obesity in Chile, Ghana, Colombia, Mexico, Malaysia. And there are incredible policy changes in Chile, happen only because the vice president of the Senate and the president were both doctors at the same time. And they stood up to the food industry, and they created sweeping policy changes, not only included an 18% soda tax, but a ban on ads on TV and radio and movie theaters, a ban on formula advertising, removal of all the cartoon characters, warning labels on the front of packages for bad food, just like cigarettes, and no junk food in schools. And they've seen remarkable benefits. The most impact wasn't the 18% soda tax. The most remarkable benefit was a 4-fold reduction in consumption of junk food because of the lack of marketing and the front of package labeling. So, for example, Frosted Flakes, there's no more Tony the Tiger, and there's warning labels. It's got too much sugar and starch in there. Soda taxes are controversial, but the data is very clear on this now. They work, they reduce consumption, they drive revenue for social programs, and they save healthcare dollars, and they reduce the risk of obesity and disease. So, for example, if 6 cities joined the taxes in 2016, if 15 more cities joined them, we'd have $1 billion in revenue. We'd save $1.2 billion in healthcare costs, and we'd reduce 60,000 cases of obesity, and we drop diabetes rates by 6%. So the data is there. It just requires a political will and grassroots activation around this. The FDA clearly needs to change the food labeling to make it more coherent and clear. The regulation around, for example, antibiotics is just atrocious. There are almost 37 million pounds of antibiotics used every year. 30 million are used for animals for prevention and growth. Only about 7 million pounds are used for sick people in the United States. That's lead to tremendous antibiotic resistance. There are 700,000 deaths around the year every year from antibiotic resistance, and it's cost about $2 trillion. The FDA basically said, please, pretty please, don't use antibiotics for growth and for treatment of animals in crowded situations to prevent disease. Only use it when you need it. Of course, that was just a suggestion and was never followed. The FDA also has not really done a good job of addressing the safety of ingredients in our food. They just recently, after 50 years of data, ruled that trans fats were not safe to eat. They allow foods like azodicarbonamide, which is a yoga mat plastic material, in most of our bread products. And in Singapore, if you use it, you get a $450,000 fine as a food manufacturer and 15 years in jail. BPA, BHT, dyes, all these things are banned in Europe and many other countries, and we freely use them here. And of course, all the agricultural chemicals that the EPA uses that are often banned in other countries. Glyphosate is a big concern. The USDA also is another agency, and all these agencies, whether it's the HHS or the FDA or the EPA or USDA, these don't coordinate. They don't coordinate, and they don't align their policies. So there are 10 different agencies involved at some level in our food policy, and none of them are talking to each other or really coordinated. I remember once being at a talk, and Tommy Thompson under Bush was the Secretary of Health and Human Services. I said, hey, have you ever talked to the Secretary of Agriculture about some of these issues? He's like, no, wow, that's a great idea. I'm like, yeah. So it was pretty funny. The other thing, our dietary guidelines, as I mentioned, are so corrupt. And honestly, they're also, people don't understand this. The dietary guidelines for Americans are for healthy populations. But 88% of Americans are not healthy. So they're irrelevant for 88% of the population, and they're not speaking to the real issues of poor metabolic health, which is mostly driven by starch and sugar. The SNAP program, or food stamp program, is another huge issue, and this issue has to be addressed because we have to have a safety net, and food insecurity is a real problem. But 75% of the food purchased is junk food, 10% is soda. We produce way more calories than we need in this country, but they're all the wrong calories. And there are ways to insert nutrition into the guidelines for food stamps. There's a lot of resistance to it, but their Bipartisan Policy Center has laid out a map for how to put nutrition back in SNAP. So those are all the personal health issues. I want to take a few minutes to go through the planetary issues. And I think what we do to ourselves, we do to the planet. What we do to the planet, we do to ourselves. We're totally connected. And most people don't understand this, but when people think of climate change, and when I've been listening to the conversations, most of it about energy, renewables, recyclables, reducing emissions. And I think all that's necessary, but it's not sufficient, because between 44 and 57% of all greenhouse gas emissions come from the global food system, not just cows and methane, which is actually a relatively small portion. I mean, the amount of food waste we have produces 3 times as much methane from off-gassing in landfills from vegetable waste as cow methane production from cow burps. But when you look at the deforestation, when you look at our farming practices that degrade the soil, when you look at food waste, freezing, retail, processing, packaging, transportation, it's about 50% of climate change. And it's fixable. And that's the good news, because these things are solvable, and what they do when you solve these issues around agriculture, they produce food that's better for you, better for the planet, better for the environment, and it's a win-win-win, and it's more productive and profitable for the farmers. We have massive deforestation. We cut down about 7 billion trees a year, size of Costa Rica. We have desertification, which is a real issue, and the loss of soil. Most people understand that rainforests are the solution to climate change, but actually soils are a much bigger carbon sink. And we've lost probably about a third to half of all the organic matter in our soil, which is responsible for between 20 and 40% of all carbon emissions. So there's 1 trillion tons of excess carbon dioxide in the environment today. It wasn't there 100 years ago. A third of that, comes from carbon released from the global destruction of organic matter in soil. Carbon is organic matter. It goes in the soil and it stays there, and it feeds the microbes, and it creates healthy soil, which is necessary to create healthy plants. So the UN said that by converting about 2 million of the 5 million degraded hectares of land globally into regenerative agriculture, we could stop climate change for 20 years. 20 years. And the cost, $300 billion. That's less than Medicare spends on diabetes every year. It's less than the annual budget of Chile, and it's about 2 months of our global military spending. And according to the UN IPCC report, we only have 60 harvests left of soil. That means in 60 harvests, we will run out of soil. No soil, no plants, no humans. This is a big deal. And many of our agricultural methods are causing this. Nitrogen, for example, fertilizer. We have 400 billion pounds of fertilizer we produce. It costs an enormous amount of energy. It's about 2% of all global energy use, mostly from fracking, which is, emits far more methane than conventional oil and gas production, and ends up also destroying the soil when you put it on there in terms of the carbon, and also releases nitric oxide, which is 300 times more potent a greenhouse gas than carbon dioxide. So it's bad all the way around. And then when it ends up in the fields, it runs off into the water and our waterways, and we have a dead zone the size of New Jersey in the Gulf of Mexico because the nitrogen fertilizer causes algal blooms, suck the oxygen, kill the fish, and we lose about 212,000 metric tons of fish in the Gulf of Mexico every year. And there are 400 similar dead zones around the world, and 500 million people depend on them for food. So this is a big problem. We've seen, the instability of our environment, an increase in climate instability. A lot of this has to do with our agricultural system, whether it's hurricanes or wildfires, the destruction of our farmland out west through the floods that we had a number of years ago with 1 million acres flooded. We're using increasing agrochemicals. It's not just the 400 billion pounds of fertilizer, but billions of pounds of glyphosate and pesticides and herbicides. And GMO has promised the world that it would feed the world, it would make hunger a thing of the past. And unfortunately, it's really failed. It does not increase yields. It does not decrease the use of agricultural chemicals. It actually increases them. And your studies have shown that in Europe, where they've not used these chemicals, their yields are equivalent or better, and their use of chemicals is way lower. And there are enormous consequences on human health. Glyphosate is used on 70 crops. It's the most abundant agrochemical used, and it destroys our microbiome. Forget about the cancer. It's like an antibiotic, and that's led to a lot of human health issues. We've lost biodiversity. We've lost 75% of our pollinator species, 50% of our livestock species, 90% of our edible plant species, 50% of our birds have been destroyed by our current agricultural methods. And there's a way to bring these back through regeneration. And this is really what's so exciting for me, is that these are real problems that are monumental, but they have a simple, elegant solution, which is focusing on regeneration and regenerative health. We talked a little bit about food as medicine, and there's a deeper conversation about functional medicine, which is a whole nother lecture. But the regeneration we can focus on is how to regenerate soil, how to regenerate ecosystems in agriculture. And doing this, is following some simple principles of regenerative agriculture that really stop with the tillage that we use that disrupts the soil, that uses cover crops, crop rotations, that leaves roots in the soil, that uses animals to actually build soil, which is critical. It's how there were 168 million ruminants in America. That's how we got 8 to 50 feet of topsoil. They weren't causing climate change. They weren't causing methane emissions because there are methanotropes in the soil. The kinds of plants that they eat are so diverse that they actually create methane, sucking up bacteria, so they actually don't produce the methane. So there's a lot of strategies around how to do this. It's been said by Russ Conzer, regenerative farmer, that it's not the cow, it's the how. And many people advocating for getting rid of meat and getting rid of cows. And I think that this is too simplistic. I think we need to understand that it's not the cow, it's the how. And that using animals in an integrated way is actually essential to building soil rapidly. And this has been done through examples all over. I have my podcast, The Doctor's Pharmacy. I've had Gabe Brown on, Alan Williams. These are farmers who've really shown this can be done. Gabe Williams, for example, converted his 5,000-acre farm a number of years ago, and he's now built 20 inches of soil. He conserves water. He doesn't use any inputs. He makes 20 times what his neighbor does. He's drought and flood resistant and weather resistant, and he's teaching farmers all around the country to do this. We've been taught, for example, that we should eat the Impossible Burger because it's going to save the planet, and we should get rid of meat. But when you look at independent life cycle analysis, the soy burger, it's glyphosate, GMO soy burgers, adds 3.5 kilos of carbon, while a regenerative burger takes out 3.5 kilos of carbon. So you basically have to eat one grass-fed, regeneratively raised burger to offset the carbon emissions of an Impossible Burger. So there's so much that's actually happening on the good news front. Companies like Kellogg's and General Mills are focused on how do they improve farming. Kellogg's agreed to get glyphosate out of its cereals by 2025, and General Mills and Danone have invested millions of acres of regenerative ag projects and funding farmers to actually provide this. So it's really exciting to see the changes that are happening within the industry. The government is not acting fast enough, but the food industry is, and they are, and it's particularly the food companies that are realizing their supply chain is threatened, the consumer demand is increased, and that they're going to run out of soil if they don't do something. And I think the government is also starting to step up. There's a bipartisan bill recently passed that would support farmers by paying them for increasing carbon in their soils as a way of doing carbon offsets. For example, airlines could buy up all the carbon offsets and support regenerative agriculture. And these are policies that need to be put in place. So I think we just need to focus on addressing these big issues like food waste. We need to look at the true cost of food that we're paying. What is the true cost of corn? We probably pay 4 times for that through subsidies, the harm to the environment, through SNAP, Medicaid, and what is the cost of feedlot burger? And it's much more than the inputs that go back into protecting it. So we have to be the change. We have to become regenitarians. We have to advocate for the right policies. We have to work together to basically solve these problems. And that's really why I wrote the book Food Fix, was to create a prescription for fixing America's food system and addressing these problems, and for all of us to learn how to become regenitarians.
Thank you so much, Mark. I really appreciate your time and sharing your expertise. I did put the link to the book in the chat. We had a lot of questions around the studies that you were citing, and so I'm hoping that if you, when we provide the video with your slides, that some of those citations will be in there.
There are about 600 citations in my book, so that is a good place to start.
That's a great place to start. Perfect. Good. Well, there was a lot of interest in a number of the studies that you cited, so thank you very much. And really, what you've provided is the foundation for the rest of today.